Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Monday, April 26th, 2021. And our top stories today: improving public health services and mental health moves to the forefront. Well, joining me now to discuss this and a lot more is Dr. Corinne Kriakou of the Department of Health Professionals and Human Services at Hofstra University. Corinne, it's so great to see you. Thanks so much for joining us on the program this morning.
Thank you. Happy to be here.
Yeah, and you have a very important role and at the School of Health Sciences and Human Services, and you actually help, I guess, graduates and or upcoming graduates try to figure out where they fit in the world of the health professions. What can you tell us there?
Sure. So this is my 19th year here at Hofstra, and I'm currently the chairperson of the Department of Health Professions, which is in the School of Health Professions and Human Services. And I also was the founding director of the Master of Public Health program. And across all the programs in this Department of Health Professions, we have a focus on social justice. We have a focus on working with communities and on helping to train the next, cohort of healthcare leaders in administration, in research, in policy, and in public health programming.
Yeah, and I think now more than ever, I think the reason why I started with that, now more than ever, I think we realized in 2020 the importance of healthcare, the importance of mental health care, which I want to get to later in this episode. What did you take away from 2020 other than the obvious, which is COVID, dealing with a horrific pandemic, the strains that it puts on families, obviously the health implications, the financial implications. What was your takeaway there?
A couple of things. Number one, I thought a lot about the importance of the public health infrastructure, which is often invisible, right? We don't really see it, and yet we rely on it as a society. We rely on the fact that our water will be safe to drink and the air is safe to breathe. And we rely on the FDA and all the work they do to make sure that vaccinations and medications are vetted appropriately. We rely on our governmental agencies to be there to protect us. And this pandemic showed, that we really aren't investing sufficiently in public health infrastructure. It took a long time for us to get up to speed in terms of contact tracing, in terms of getting the message out and making sure we had testing sites available. It also, I think, uncovered the huge disparities that exist in the most vulnerable communities, sometimes because they're, economically vulnerable, but also, from an age perspective and from immigration status and other kinds of vulnerabilities. So it really showed we need to do a better job, not during the crisis, but long before a crisis occurs, to make sure that those channels of communication, the supportive services, the connections with those communities are strong and kind of ready to go.
Yeah, absolutely. I think that there's a lot of weaknesses that need to be improved through infrastructure and making sure that we have people in place to do the right things. Let's talk a little bit about the students. You've been doing this, I think you mentioned, for 19 years. You're dedicated, you're passionate about this issue. The students that are coming to Hofstra to come into this level of coursework, can you describe some of them? Is it from varied backgrounds? What motivates them to pursue this line of work, in general?
Mm-hmm. I do feel like there's some common thread among a lot of the students that come into the Department of Health Professions, and that is this, passion for wanting to improve the world, So some of them are pre-med, preclinical, and they want to go into the clinical professions and become doctors and nurses and therapists, which is phenomenal, and that's one big piece of the puzzle. The other set of them, and some of them know this when they come in, and some realize it through throughout their time with us, they want to go into administration and in healthcare, and they want to try to improve the way organizations run and whether or not they're, receptive to and responsive in a culturally appropriate way to all different kinds of communities. Some of them want to go into policy, and again, not all know when they first come in, but realize that that's how we change things on the population level, right? That's, it's important for us to do individual clinical level work, but we also have to make big changes at the policy level so that organizations and workplaces and educational institutions and media and other ways of getting out information, have a different incentive, have different guidelines so that they are being inclusive and helping to improve communities, making them stronger so that people can thrive. So I think they do have that common thread of wanting to improve, how society is responsive to communities.
Yeah, and I would say, I would ask you as a follow-up. I mean, you've been at the university for quite some time. You've seen different cohorts and generations go through. Is there something particular about? I guess we're up to Gen Y, so these are the right Gen Z. No, Gen Z. I mean, is there something? Is it something with this particular generation, or I'm a Gen Xer. I believe in all those things. I want to make sure we have a society that helps everybody, raises all people, lifts all ships, to quote John Kennedy. But what particular about this generation kind of strikes you as interesting?
I think that they are, and if I can compare them to myself and my cohort, I think that they are more open-minded. I think they are a little bit more innovative and creative, a little bit less, confined to kind of, the box or, the existing policies, to use that word again. I think that they are more optimistic about being able to kind of come up with creative solutions. I think about that in terms of, just to tie it back to older adults, we accept the fact, or we have, certainly my generation, what the retirement age has always been. I think young people approach it like, what? Like, no, that's not necessarily going to be the case. And, they're much more open to kind of thinking differently about, societal structures.
Yeah. And let's talk about retirement and aging. The last week we did some shows on aging. Global aging is I don't know if it's becoming very taxing. We have a very low birth rate. We're living longer, which is wonderful. It taxes the services that we're talking about. What's your take on aging? Is it that retirement is a graduation to the next level of your existence? That maybe you're ending one chapter and starting a new chapter. But what's your take?
Just to start with what you ended with, I mean, I absolutely believe that partly because of changing demographics and partly because of changing expectations, we are looking at this third stage, so to speak, much differently than we ever did before. We're not only living longer, we're living healthier, right? That lifespan and the health span is increasing. And that's, tied into so many different things, obviously advances in technology and medicine, and certainly in public health, like sanitation and diet and exercise. I mean, we are aging in a healthier way than predecessors did. And so we're going to want to stay engaged, and we're going to be healthy enough to do so for a very long time. So that traditional idea of retirement, while it still might be exciting for some, it's not necessarily, it doesn't mean that you need to work until you're 85 or 95, but people are going to want to be meaningfully engaged in whether it's being productive or in giving back, in solving, social problems. And I think, as a society, we need to catch up with those demographic trends. We need to think a little differently. We need to redefine, what does it mean to be part of the workplace, in the 70s and the 80s and the 90s? Because it may not be the traditional 9-to-5 job that older adults want, but they want to be engaged. And we should harness what they bring to the table in terms of wisdom and experience and the capacity to be collaborative and to solve problems. So I think we will. I think universities need to redefine what they think of as students. Older adults may want to come back. I expect they'll be coming back for, additional and new, maybe chasing passion dreams, at new education, but not necessarily for the 4-year degree or the 36 or 42 credit graduate program. They may want something a little bit different than a certificate and different than a degree. And so we have to start rethinking how we look at work, how we look at leisure, how we look at housing, how we look at education, and how we look at how our communities are built so that they make it possible for the older adult to be as engaged as they want to be.
Yeah, well said, well said. Well, Corrine, I want to take a very quick break. When we come back, we'll talk to Corrine about mental health, mental health facilities, and a lot more. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking to Dr. Corrine Kriakou of Hofstra University. Corrine, thanks so much for staying with us this morning.
Thank you for having me.
I want to segue now to something I think that up until recently, it's just my opinion, anecdotally, no numbers behind it, something that's kind of been underreported, under-discussed, and that is mental health. And we've seen the impact of this pandemic, not only from a health perspective, a financial perspective, but also a mental health perspective, whether you're mature, a mature American, a younger American, a school-aged American, all these different demographics have been significantly impacted mentally as well.
Absolutely. I mean, I completely agree with that. And I think that maybe that's a silver lining of the pandemic, that we have a renewed understanding, an expanded appreciation for how critical, mental health and our mental hygiene is. We can't just be focused on our physical health and our physical hygiene, which was so critical in the pandemic, right? But what about our mental hygiene? What can we do preventatively to address the fact that, we are under such incredible stress through this pandemic and also through other challenges that we're facing even pre-pandemic. So I think that maybe there is a little bit of a renewed focus. I know here at Hofstra, there is this semester we had for the first time a series on mental health resiliency, just looking at, how students can, think about what activities and actions they can take themselves to protect and to strengthen their own mental health. So that, I think that was a real positive.
Yeah, absolutely. And the loneliness factor, when early days, I still go back to the 15 days to stop the spread, right? That was, I remember the card, right? It's 15 days to stop the spread. And that was really the initial mandate, and it just kind of ballooned and expanded as the virus expanded. But for those people, especially single individuals, maybe living alone, being isolated from family, friends, has a deep rooted impact on them, not only today and in the future. And then for younger people, maybe maybe they're college age, going to school at Hofstra and other places, not being able to see their friends, but attending classes through Zoom, though productive in a sense, you kind of lack some of that connectivity. And by nature, Corinne, humans, we need that interaction to survive. And that is so important for that cognitive ability and that mental health.
Absolutely. And there's a growing body of evidence of data that really shows how social isolation and loneliness can have not only mental health impact, but huge physiological impact as well. And so, we need to think about how to help people across the age spectrum stay connected. I'm particularly concerned not only with what happened during the pandemic, but in general with how older adults may face and struggle with social isolation. And I'm happy to see that there have been, there's more programming around engaging older adults in the life of communities, more intergenerational programming, more use of technology, really dispelling the myths that older adults are not, able to or interested in interacting through technological sources. I think that that's something else the pandemic showed us, that, while we didn't have it ready to go, which was a problem, we were able to build in lots of virtual programming across, the age spectrum, but even for senior centers to run virtual, programming for older adults who couldn't get out and shouldn't have gone out, during the most dangerous time of the pandemic. And so I hope that continues. I think that'll continue. I think telemedicine, which really was piddling along before the pandemic and then exploded during the pandemic, I think we're going to see a lot more of that too. And I think it'll be integrated with some of the traditional ways we interact with healthcare or with entertainment or with interaction. But I think you'll see more and more of the use of technology to help us stay connected.
Yeah, the school does a lot of research, and I wanted to, you in particular do a lot of research. What are some of you and your peers, both at the university and around the higher education community, doing in terms of research around this topic, whether it's mental health, whether it's health science, whether it's kind of improving the infrastructure? What are some of the topics du jour, if you will, and some of the things that you all are looking at to make things better?
Mm-hmm. Well, one of them is what I referenced before in terms of telemedicine, really in terms of, lots of research happening, here at Hofstra and at Northwell with our colleagues around the effectiveness of managing chronic illnesses through a combination of traditional sources and through telehealth. So I think that offers tremendous opportunity to keep patients connected in a way that is more amenable to their functional capacity and to ensure that we capture things earlier. So I think telemedicine and telehealth, lots of research happening there. I think we're also learning about the effectiveness and usefulness of mental health. And so there's lots of research happening around that because we know we have a shortage of mental health providers. We certainly have not only an increased need and demand, but an increased recognition of the need for mental health services. And so one of the ways we can kind of match the supply and the demand is through technology, and using that to kind of bring mental health services to places where, perhaps there are not a lot of providers available, and also to make it a little bit easier for folks to engage in that kind of counseling and therapy. So I think telemental health is another big area that we're going to see continue to develop. There's also, lots of interesting things happening around how do you create opportunities for meaningful social engagements, right? There's a project I'm working on with age-friendly Glen Cove right now to build a time bank. I think a time bank is a really cool, innovative solution. There are time banks all over Europe and many throughout the United States. Essentially, they're barter systems that enable people across generations to swap skill and help each other out, to enable them to live and thrive in a community. So it's a non-monetary kind of membership-based program, and it really is value to both the provider and the recipient, because the provider gets to contribute to society, and the recipient is also someone else's provider because everyone has something to offer. So it's this, swap, and it's one-time dollar for every 1 hour of service, regardless of your helping change a light bulb or helping somebody with, language or taxes. So I think those kinds of new, innovative kinds of solutions will help us, find ways to stay more connected.
Yeah, and hopefully this research flows down to policymakers to help make better decisions when it comes to infrastructure. I know this is, as you said at the beginning segment, this is really top of mind. Karine, we're going to have to leave it there. It's been an absolute pleasure to chat with you. I really thank you for coming on the program and sharing your perspective. We look forward to having you back very soon.
I hope so. Thank you so much.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, then drop us a line. And don't forget, for all the information in retirement markets, technology, personal finance, so much more, check out today's edition of our daily newsletter, The Morning Pulse, and of course, our website. We're back again tomorrow, so until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Are you being audited? And do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.